The objective of our study was to compare the efficacy of two antibiotic regimens, ampicillin alone versus ampicillin plus gentamicin in prolonged rupture of membranes at term among patients with negative GBS colonization status. Women were randomized into two groups to receive ampicillin alone, 2 grams every 6 hours, or ampicillin with gentamicin, 5 milligrams per kilogram every 24 hours. The primary outcomes were clinical chorioamnionitis and endometritis. The secondary outcomes included both maternal and neonatal outcomes. The study was conducted between November 2022 to July 2025. The randomization was computer-generated with a sequence of 1:1. Our study population included women with term prolonged PPROM and negative GBS colonization status. Inclusion criteria were women with term singleton pregnancy at vertex presentation and negative GBS colonization status, who presented with rupture of membranes. Exclusion criteria were positive or unknown GBS status, sensitivity to the study's antibiotic regimen, active labor, and women receiving antibiotic treatment for other indication. A total of 1,293 patients were assessed for eligibility. Of these, 1,085 were excluded. 65 patients declined participation. At 18 hours after PPROM, 208 eligible patients were randomized. 104 patients were allocated to receive ampicillin alone, and 104 were allocated to receive ampicillin plus gentamicin. One patient in the combination group withdrew consent after randomization. There were no losses to follow-up or discontinuations in either group. All patients were analyzed according to the intention to treat principle, with 104 patients in the ampicillin group and 103 patients in the combination therapy group. Background data. Parity, BMI, and delivery weeks were similar. Laboratory findings at admission, including white blood cell counts and CRP levels, were similar. Regarding the co-primary outcomes, clinical chorioamnionitis occurred significantly less often in the ampicillin gentamicin group compared with ampicillin alone. The number needed to treat was 11.5. Rates of postpartum endometritis were low in both groups, with no statistically significant difference. Among the pre-specified secondary outcomes, intrapartum fever was significantly lower in the ampicillin gentamicin group compared with ampicillin alone. Overall, postpartum infectious morbidity was also reduced. Rates of postpartum fever, prolonged postpartum antibiotic use, and surgical site infection were low and did not differ significantly between groups. Secondary obstetric outcomes were similar between groups, including cesarean delivery, operative vaginal delivery, and oxytocin use. However, prolonged postpartum hospitalization, greater than 5 days, was significantly less frequent in the ampicillin gentamicin group. NICU admission due to suspected early-onset sepsis was lower in the ampicillin gentamicin group. Other neonatal outcomes were similar. Chorioamniotic swab cultures were obtained from 181 patients, 91 from the ampicillin gentamicin group and 90 from the ampicillin group. Positive cultures were less frequent in the ampicillin gentamicin group, 20.9%, than in the ampicillin group, 36.7%, p equals 0.029. Enterobacteriaceae species were isolated less frequently in ampicillin gentamicin group than the ampicillin group, p equals 0.033. Our study's strengths include its randomized prospective design and its focus on a clinically relevant question regarding optimal antibiotic regimens for PPROM greater than 18 hours. Limitations include the open-label design, limited power for neonatal outcomes, and the absence of an untreated control group, which precludes determining whether antibiotics are required at all in GBS-negative prolonged PPROM. Conclusions. Among GBS-negative patients with PPROM greater than 18 hours, the rates were lower of clinical chorioamnionitis and postpartum maternal and neonatal infectious morbidity following the prophylactic administration of ampicillin plus gentamicin compared to ampicillin monotherapy. Broader gram-negative coverage may improve maternal and neonatal outcomes and warrants further evaluation.